Okay, scanning the room. Okay.
Okay. First thing I'm going to do is take off the dressing on my wound, and I'm going to carefully take off the tape and then take off the gauze and dispose of it. Going to assess when I'm looking at it, and then I'm going to, when I took off my wound, I was wearing clean gloves, and then I take those off and I put another pair of clean gloves on, and I'm going to start cleaning. So I take my syringe with saline, have the patients on their side, and I'm going to irrigate from least contaminated to most contaminated. 1, 2, 3, and do it again. Same motion. Let it all drain, and then I am going to dry the wound by going in one direction, folding the gauze, another direction, folding the gauze, and one more time. If I needed to clean it and dry it anymore, I'd get another piece of gauze, but this looks good. Put it over here. And then I'm going to begin packing and doing a wet to dry dressing. So I have a piece of gauze here in the saline. Going to open it up and scrunch it and pack in the wound. Taking my Q-tip, I'm going to feed it into the wound, filling in all the dead space. Okay, and then I'm going to take gauze and place it over. And if the area of the wound was bigger, I could also take a combine pad and tape this all down using the window pane method, and then my wound's all set. And next I'm going to administer a soap suds enema. So I would mix in the soap suds and and water and mix this together until it is all prepared. And then I'm going to explain to my patient that they should feel like a little discomfort during insertion, but if they experience any cramping, then I'm going to stop, and if they're in any pain at all, I'm going to stop. But I'm going to close the clamp during insertion, have this up so that it can drain into the patient, remove the tip. This is already lubricated. I would have the patient lying in left sims, privacy curtains, and having them covered until I'm ready to begin. And left sims are going to be on their left side with their right leg bent. Going to lift up their gown and insert about a couple inches, 2 or 3, and then I'm going to ask them to hold it as long as they can, and then after I pull it out, and then I'm going to help them move into a bedpan, and I also have a Chuck's pad underneath them.